India is dealing with one of the worst pandemics. The healthcare structure is on its knees during these times of intense crisis. But in this, there are some redeeming aspects, people willing to help each other. The Student Islamic Organization and the Jamaat-e-Islami Hind are bridging the gap in saving lives. A COVID task force set up at Delhi's Jamia Nagar has connected over 10,000 COVID patients with healthcare facilities.
At this COVID Task Force Centre located in Delhi's Jamia Nagar, students and citizens of Delhi have come together to provide COVID assistance to those who are desperately searching for oxygen, beds, even plasma for their dear ones. What began as a 24/7 helpline number is being operated by 30 Delhi-based volunteers and is now across the country.
There were lots of SOS calls for real-time information like where do I get an oxygen bed in Delhi, or where do I get an oxygen cylinder or a refilling in Hyderabad. We thought that what about starting a help desk so that we can provide real-time information for the patients in these areas. In every state we do have hundreds of volunteers in the ground for giving us the verified resources.
An initiative by Student Islamic Organization and Jamaat-e-Islami Hind, it now has over 1,000 volunteers spread across all states who are using the power of social media to ensure that COVID patients get medical aid in time.
So we will try to verify it by ourselves. There are lots of resources, lead of resources all over the social media, but the issue is that mostly fake and are also mostly expired.
Within a couple of weeks of being set up, the team has received around 18,000 requests and has provided verified information about resource providers to over 10,000 patients. They say over 40% of the requests that they get are for oxygen and most of them are from Delhi and Uttar Pradesh.
हमारे यहीं पे कॉल ऑल ओवर इंडिया से आता है, जैसे कि पहले दिल्ली, उत्तर प्रदेश, बिहार, झारखंड और आपका हरियाणा यानी कि दिल्ली NCR से बहुत ज़्यादा ही कॉल आ रहा था. अभी वहीं का कॉल आना थोड़ा सा कम हुआ है, लेकिन उस दरमियान पे हम लोग देखे थे जब कॉल रिसीव कर रहे थे तो साउथ इंडिया से उस वक्त कॉल बहुत ही कम आ रहा था या नहीं भी बोल सकते थे, लेकिन अभी थोड़ा साउथ इंडिया से कॉल आना ज़्यादा हो चुका है और नॉर्थ इंडिया का कॉल थोड़ा सा कम हुआ है आने के लिए.
मोमेंट में से अगर मैं एक शेयर करना चाहूँ तो हमारे पास एक कॉल आया एंड द पेशेंट वाज ओनली 27 ईयर ओल्ड and she was 27 year and उनका ऑक्सीजन लेवल था 80. तो हमें ऐसा लगा कि हम प्रोवाइड करा सकते हैं और हमारे पास लीड थी भी. तो एक हमारे जो वॉलंटियर थे उन्होंने कॉल ली, रजिस्टर की और वो हमारे पास आया एंड वी वर जस्ट डायलिंग हर नंबर. तो दोबारा हमारे पास कॉल आता है कि शी डाइड. तो 27 ईयर ओल्ड एंड 80 ऑक्सीजन लेवल. तो हमारे पास लीड थी, हम प्रोवाइड करा भी सकते थे लेकिन करा नहीं पाए. तो these are the moments only.
At a time when Indian citizens are angry at the government for not being able to provide basic COVID resources, others have come forward to help those in need. COVID task forces like Student Islamic Organization and Jamaat-e-Islami Hind have emerged as a ray of hope. These organizations have taken over the state's responsibility as COVID cases continue to surge. In New Delhi, Arshi Qureshi for NDTV.